OTC and self-care questions trip up so many candidates, not because the drugs are complicated, but because the exam tests your clinical judgment, when to recommend a product, when to refer, and what to tell the patient. Stick around because in the next few minutes you'll have a framework that makes these questions feel predictable every single time. Here's the thing about self-care questions. The drug itself is usually straightforward. What the exam is really testing is whether you think like a pharmacist standing at the counter. A patient walks up. Do you hand them a product, or do you pick up the phone and refer them to a doctor? The answer lives inside the patient's age, their symptoms, how long they've had them, their other medications, and their comorbidities. Train yourself to extract those 5 data points before you even think about an answer choice. Think of every self-care scenario as a traffic light. Green means you can recommend an OTC product confidently. Yellow means you proceed carefully, maybe recommend with close follow-up. Red means stop and refer. Red flags include blood in any body fluid, symptoms lasting longer than expected, high fever persisting beyond 3 days, or severe pain. Special populations, pregnant patients, very young children, patients with kidney or liver disease, automatically shift you toward yellow or red. Burn this framework into your memory and you'll eliminate wrong answers quickly. Acetaminophen, ibuprofen, and ASA are the 3 pillars of OTC pain and fever management, and the exam loves to pit them against each other through patient profiles. Acetaminophen is your go-to for pregnant patients, but flag that high dose or long-term use is dangerous in liver disease. Ibuprofen is an NSAID, so it can worsen kidney function, cause GI bleeds, and is contraindicated in the 3rd trimester. ASA should never go to a child or teenager with a viral illness because of the Ray's syndrome risk. Know the maximum daily dose is cold. That detail shows up more often than you'd think. Gastrointestinal complaints are a huge self-care category. For heartburn and indigestion, understand the spectrum. Antacids act in minutes but wear off fast and can interfere with the absorption of other drugs like tetracyclines and fluoroquinolones if taken too close together. OTC H2 blockers and PPIs take longer to work but last longer, and most guidelines cap unsupervised OTC PPI use at 2 weeks before a patient should see a physician. For constipation, match your agent to the situation. Bulk forming first, osmotic agents for quick relief, stimulant laxatives short-term only. Always refer for alarm features like rectal bleeding. Colds and allergies generate a ton of self-care questions because the contraindications are very testable. First-generation antihistamines like diphenhydramine cause sedation and have significant anticholinergic effects. They're risky in elderly patients and in anyone with benign prostatic hyperplasia or narrow-angle glaucoma. If the patient needs to drive or operate machinery, go non-sedating. Oral decongestants like pseudoephedrine raise blood pressure. They're problematic in hypertension and hyperthyroidism, and remember that behind-the-counter rules apply to pseudoephedrine in Canada. When in doubt, nasal saline rinses are effective, evidence-supported, and safe for virtually everyone, including young children. Skin conditions are frequently underestimated in self-care prep. Low-potency topical hydrocortisone is OTC, but candidates need to know its limits. Short-term use only, and avoid using it on the face or skin folds in children without medical supervision. For fungal infections, identify whether you're dealing with a dermatophyte, like tinea pedis or ringworm, or a candida infection, because while the azole antifungals treat both, the clinical presentation guides your recommendation. Sunscreen counseling is also fair game. SPF 30 or higher, broad-spectrum UVA plus UVB protection, and reapplication every 2 hours or after swimming. Always refer an immunocompromised patient. Any skin infection in that population can escalate quickly. On the exam, it's not enough to pick the right drug. You have to counsel correctly too. Think of counseling in 4 beats. Tell them what the medication is and why you're recommending it. Explain exactly how to use it, including dose and timing. Set realistic expectations about when they should feel better. And critically, tell them when to come back or seek further care. Using plain language is non-negotiable. Phrases like, "take this medication for inflammation," should become, "this helps reduce swelling and pain." Always check understanding using a teach-back approach. On written scenarios, show you've thought about follow-up, not just the initial recommendation. Let's lock in 2 tools you can use instantly. First, ScholarMac. Symptoms, characteristics, history, onset, location, aggravating factors, remitting factors, medications, allergies, conditions. This gives you a complete symptom picture for any patient every time. Second, when you're unsure whether to refer, remember the word red. Is there blood? Is the pain extreme? Is the duration longer than expected for a self-limiting condition? If any red flag is present, refer. And when choosing a product, run it through SEX. Is it safe for this patient, effective for this condition, cost appropriate, and suitable given their full profile? These frameworks make your thinking visible and consistent. You just covered the full OTC and self-care framework, from the refer versus recommend decision tree, through major drug categories and their contraindications, all the way to counseling language and high-yield mnemonics. If you want to go deeper, we've put together a detailed study guide and practice question bank specifically on this topic. It's available on our Etsy shop, and the link is right in the description and pinned in the comments below. If you've got a specific OTC scenario or concept that's been confusing you, drop it in the comments. I genuinely read them and I'll answer. And hit subscribe so you're the first to know when we drop the next video. You're putting in the work, and that matters. Keep going. If this helped, check out these other PEBC Buddy videos to keep your prep going.